All right, so I mean, formerly you'd hardly hear some diseases creeping in. When you hear them, it means it came with old age or some lifestyle, if you ask me. But nowadays, especially some non-communicable diseases, they get to creep in before you know you're diagnosed. It's too late and you're in a mess, and there's a lot of worry. Today, let's talk about childhood cancer and what that is. And for me, what I heard about it, it's a bit, for me, scary. Maybe it's not. And that's why we've brought in two people who are experienced. One is a medical practitioner from what I see, especially with the title. Dr. Adjoa Ahimanuno is a medical practitioner indeed. And of course, a mother of a child cancer patient, Letitia Abena Nate. Thank you very much for joining us, and we're truly grateful. Is it okay that I am afraid because I don't know about it, I've not experienced it before, but I hear of cancer and the way people suffer through it? Is it okay for me to be afraid?
Well, not to be afraid per se, but I mean, you always say knowledge is power.
Okay.
If you had enough knowledge about it, I don't think that you should be afraid of it. And in this part of the world, the reason why usually most childhood cancers do not really go too well or end up being terminal because people really don't have enough knowledge about it. Okay, they don't really know what the symptoms of childhood cancers are. Financially too, they're a bit challenged as well. Because of the delay in diagnosis and then the treatment that they can't afford, most people end up going to herbal medication and then prayer comes and all that, and not really seeking the appropriate channels. So, in as much as it sounds scary, it's quite rare, but when it happens, because people don't really have enough information about it, they don't seek treatment on time, and that's why it ends up we hear such bad cases of childhood cancer.
I see. Before I come to Letitia, let's walk ourselves through what cancer is and why children will be engaged in such a disease.
Okay. So cancer is an abnormal growth of cells. The cells just grow and then they stop at a particular rate when they are growing. We have mechanisms that are put in place to stop this growing and all that. It's normal. It's a part of growing. But in cancer generally, in both adults and children, the mechanisms that will stop the growth of these cells are impaired or they are not working due to several circumstances. It can be genetics, it can be environmental factors, it can be lifestyle factors and all that. So instead of the cells, maybe if it's breast, if it's bone or whatever, I tell them to go at a particular rate and stop growing. These cells grow quite abnormally. And then you get tumors and all that. So that is when you say it's a cancer. It's just an abnormal growth in cells.
Okay.
Yes.
So it could be anywhere in the body?
It can be anywhere in the body. It can be of the brain, you can have bone, your arms, any part of the body at all, any organ, the kidneys, the liver, every part of the body cannot be spared because there are cells everywhere, you know, and yes, without cells you can't function. So definitely you would have cells in your body. It's a normal thing. And then when it's an abnormal growth, then it's cancer. It's cancerous.
I see. Let me find out so that while I'm taking the experiences from Letitia, we could be having the solutions and, of course, breaking it down, packing the whole issue. So, Letitia, you have a child that has cancer.
Yeah,
at what age did you realize that there were some issues?
Well, the child was then young. You know, I had two girls, and she was the second born. So what happened is she normally gets sick. Okay, she gets sick, and I take her to the hospital. That was around 3 years, getting to 4. So I take her to the hospital and normal treatment. We come home and a whole lot. Until one day we went to the hospital, and when we came back, I realized that she was complaining of joint pains all along. So I was even thinking it was sickle, because then the father was AS. Okay. So when I took her to the hospital, and the doctor was even trying to find out whether she was sickle, and I said no. If that's the case, then they should do a lab test for us to see whether. By then, she already had a lump, a small lump on her forehead. Yes, so that's when the doctor asked whether that is paining her. So she said it's not even hurting. So the doctor decided to admit us so that they can take lab tests. It was on a Saturday. So they asked us to, they admitted us so that we can stay there on Monday for the lab. Okay, so it was the lab result that I was given by a nurse, you know. The file was given to me to send to the doctor. So when I was going to the doctor, I tried to open the file to see the results. So when I opened, I saw malaria leukemia. Then it was 12 years ago. Okay, my daughter died 12 years ago. Then I don't know what, I don't even know whether a child can get cancer. Okay, I know the first time I heard of cancer was when Dr. Danny White, well, yes, he was advocating for cancer. That was when I even heard the name malaria leukemia.
Oh, okay.
If not,
so
I don't
malaria
even know.
leukemia is cancer?
Yeah.
I didn't know, madam. Thank you. Thank you. I didn't even know.
Because, so when I saw the malaria leukemia in my child's file, in fact, then I began to shiver because I heard that from that cancer advocate, and even he died. He died. So when I saw that, in fact, so when I go to the doctor was not even willing to tell me.
What exactly was?
Yes, so he just said, madam, we have to transfer you to Kolebu so that at least they will go and do further tests. Then I asked doctor, I saw my malaria in my child's file. What is it about? Is it cancer? Then the doctor said, madam, do you know that? The first he asked, who gave you the file? And I said, it's a nurse. Then he said, no. Madam, do you know that it's not good to be intelligent? And I said, doctor, he should try to explain. Then he said, no, they can't tell whether it's true that what they saw. That is why they are asking me to go to Kolebu for further tests. So that's how I got to know.
To know.
Yeah.